So here I'm going to be doing the Lockman's test. I'm going to have the patient laying down supine, and I'm going to have the knee flexed to about a 20 to 25 degree angle. So just pick up the knee, and with your hands you're going to support the weight of the leg. With one hand I'm going to grasp the tibia around the level of the tibial tuberosity, and then with my other hand I'm just going to hold around the tibia where the condyles are. So while I'm supporting the weight of the leg, I'm going to apply a posterior pressure to the femur to stabilize it, and I'm going to have an anterior pressure to the tibia area. And you're just going to pull like this. So a positive test is going to represent an anterior tibial translation compared with the opposite or uninvolved limb. And this will essentially represent a sprain of the ACL and a sprain of the posterior lateral bundle of the ACL. So here I'm going to be doing the Godfrey's test. My patient is laying supine on the table. I'm going to lift his legs to 90 degrees, have him hold it there, make sure that his legs are parallel to the table, exactly at 90 degrees. So what I'm looking for here is a sprain within the PCL, and I would be able to tell this because there would be a downward displacement of the tibial tuberosity. As you see here, his test is negative, so there is no downward displacement. But if there was, you would be able to tell by modifying it, if you even had to, by placing a ruler, so it's more obvious if there's an injury. So the lower leg must be stable, and just be sure to have his legs exactly at 90 degrees. We're going to be doing the Trendelenburg's test. So my patient is standing on both legs, have his weight equally distributed on both legs. Now I'm going to have him pick up a leg opposite of the side that we're being tested. So here we're going to test his left area. So what we're going to do is look for any type of pelvic obliquity. Right now his is pretty even, so that's a good sign. But a bad sign would be if there was any type of pelvic tilt, and this would represent a muscle weakness as a result from root impingement on the damaged superior gluteal nerve. So here I'm going to be doing the McMurray's test. The McMurray's test tests for medial or lateral meniscus tears. So my patient is laying supine, and I'm just going to lift his leg. With one hand, I'm going to grab his foot calcaneus area, and I'm going to place my hand over the anterior medial and the anterolateral area of the knee. So what I'm going to do is, with the tibia in the neutral position, I'm going to apply a valgus force. And then I'm going to flex the knee, look for any clicking or popping, and then I'm going to apply a varus force through the extension. Now next I'm going to apply, or with the tibia internally rotated, I'm going to apply a valgus stress with knee flexion and a varus stress through extension. And now you can do these multiple times, but for the sake of the video, I'm just going to do it once. And now for the last run, I'm going to externally rotate the tibia and apply a valgus stress into knee flexion and a varus stress back into extension. Now you know if it's a positive test if there's any clicking or popping within the anterior medial anterolateral area. And so if there is a stress, if there is a clicking or popping, that means there is a tear within the medial or the lateral meniscus.